Well, value depends, I think, on several factors that vary. One is just the perspective of the decision maker. So value to an employer, for instance, might be very different than value to an insurance company. The employer might worry about the number of sick days, how productive its employees are, how healthcare affects that productivity. The payer might be more focused on things like the medical costs, the prescription drug costs, the direct health benefits, and might be less concerned about things that the patient cares about, things like burden on family members for care. So value is going to generally incorporate different aspects depending on the perspective of the decision maker involved. I think that right now we're in a situation where we're trying to figure out how to measure value. I think there's a lot of controversy over how to measure value. And we see that in all of the debates about what value frameworks to use and how to construct value frameworks. I think actually the bigger question here is, how do you bring value into the marketplace? Because even if we magically figured out tomorrow how to solve all these measurement problems, it's still not 100% clear what we would do next. Would we hand those numbers over to a new federal agency to regulate prices? Would we somehow use those numbers in the marketplace to help decision makers make price decisions that are more aligned with value? No one really knows. And I think we need to begin to work on that problem if we're ultimately going to make an impact on value in healthcare more generally.